Imagine living with skin so fragile that even a gentle touch can cause painful wounds. This is the reality for people with a rare condition called recessive dystrophic epidermolysis bullosa, or RDEB. RDEB is caused by a defect in the COL7A1 gene, which produces a vital protein called collagen 7. Without enough of this protein, the skin's layers fail to anchor properly. Blisters and chronic wounds form, leading to pain, infections, and life-threatening complications. Until recently, there was no cure, only wound care and pain management. But today, a revolutionary therapy is offering real hope. Doctors begin by taking small samples of the patient's own skin cells from a lesion. In the lab, scientists insert a healthy copy of the COL7A1 gene into these cells, effectively fixing them. These corrected cells are then grown into sheets, engineered skin grafts, ready to be transplanted back onto the patient's wounds. Once applied, the grafts produce normal collagen then, anchoring the skin layers and allowing chronic wounds to heal. Many patients in clinical trials saw dramatic improvement within months. Less pain, fewer bandages, and a new chance at a normal life. This therapy, known as prademagene zamikeracel or Zavaskin, is the first of its kind approved by the FDA for RDEB. It marks a turning point, treating not just the symptoms but the root cause of a devastating disease. And this is only the beginning. The same approach could one day help burn victims and people with other genetic skin disorders. The dream of rebuilding skin from a patient's own corrected cells is now a reality. Science is transforming lives, one gene, one cell, and one patient at a time.